Do you know your HIV status? When you do, you can take control of your sexual health. HIV self-tests give you the power to decide when and where to test. You just swab and stick it in the tube. Test in the privacy of your own space. You can set a timer, sit back, and wait. In as little as 20 minutes, you'll know your results. No matter your test results, you have a community waiting to support you.
I love being able to test where I want.
I love that it's confidential and quick.
You gotta love free.
It makes me feel empowered.
When I show myself love, I show my community love.
It's important to know my status.
It's important to know your status.
It's cool to know, you know?
If we all get tested, we can stop HIV together. Learn more about HIV testing, including free HIV self-tests, at cdc.gov/HIV self-testing.
All right. Good afternoon. I am Carl Baloney. I serve as Vice President for Public Affairs and Chief Policy Officer with AIDS United. Welcome to our Fireside Chat, the future of HIV advocacy, visionary pathways for the next administration. I'm joined here by Robert Suttle. Robert is a consultant to advocacy organizations and thought leader confronting critical issues such as HIV criminalization, stigma and discrimination with a focus on equity and social justice. Robert chairs the Elizabeth Taylor AIDS Foundation Council of Justice Leaders and is a global advisory panel member of the HIV Justice Network. He's also a co-founder of the Cero Project. Additionally, Robert authored the foreword for Alexander McKellen's book, Criminalized Lives, HIV and Legal Violence. Good afternoon, Robert. Welcome.
Hi, Carl, and hello, everyone. And I'm going to introduce Carl Baloney Jr. It's AIDS United's Vice President for Public Affairs and Chief Policy Officer. He's a longtime advocate for vulnerable populations and has focused much of his career on innovative policy solutions that benefit disenfranchised communities across the country, with a particular focus on the rural South. As a board member for both the National AIDS Housing Coalition and Planned Parenthood Advocates for DC, Maryland, and Northern Virginia, Carl has expanded their ability to lead through collaboration. For the past decade with AIDS United, Carl had steered the organization's federal HIV advocacy and policy engagement in support of its nearly 60-member public policy council organizations to shape public policy around dozens of key areas, ranging from access to care, harm reduction, sex workers' rights, racial justice, housing, and more. So that's impressive, Carl. I'm glad to have this conversation with you today.
Absolutely, my pleasure. And thank you for making the time. I think back when I joined this movement, I think back in 2015, you'd already were a known quantity in the work, and I met you early on in my time at AIDS United. So it's been great to watch your career, watch you tell your story, and help shape advocacy for quite some time now. So just thinking, kind of jumping into the questions, Robert, I wonder if you could tell us what initially drew you to advocacy and your movement work in HIV decriminalization and racial justice.
Okay, thank you for that question. So as I reflect back, it seems inevitable. Unbeknown to me, by the age of 24, when I was diagnosed HIV positive for trying to enlist into the military, I could not serve. And so I pretty much left it at that. But what I didn't know, again, growing up as a Black young man, that we in the Southern United States, we were living in the epicenter of a perfect storm where there was overlapping crisis of mass incarceration and the issue of the HIV epidemic converging. And so these things were unbeknown to me growing up. And so that created this reality that I didn't know that I was growing up in, which was that, the chance of being vulnerable to HIV and also the likelihood of experiencing incarceration in my lifetime. And so that's why I say I think it's inevitable, because the conditions in which I was living in at some point intersected with my life or impacted my life. And so, and with this issue of incarceration, now that we're living in this era of mass incarceration, it disproportionately impacts Black Americans, people with disabilities, and LGBTQ people. And coming from the South, I'm from Louisiana. They are big on this tough on crime policies. that often criminalize public health issues. And so, again, I'm saying this because this was something that I was not aware of. And so I experienced HIV criminalization because of this approach, right, too tough on crime, and to this approach of criminalizing health status. And so my advocacy is really motivated by these deep-seated injustices that continue to shape states' public health policy as well as the criminal legal system. And so from that experience, I ended up co-founding the Zero Project to represent people who have been impacted. Usually when you hear about HIV criminalization, you hear about it from law enforcement, from courts, from public health officials, people who themselves have never experienced HIV criminalization, but yet they are enforcing it, they are perpetuating it, as well as the public. And so, but what was missing was my voice, or the voice of those that are impacted. So it's the same situation for anyone that's even newly diagnosed. You know, you rarely ever hear their story. And then to experience HIV criminalization the second time, as far as the disruption in my life as it relates to HIV, I felt that this was something that was important, that we needed to bring more awareness around. And also we needed to amplify those voices of the people who were directly impacted, not just by their HIV diagnosis, but also by HIV criminalization.
That's amazing. Thank you for sharing.
And so, and while we're on that topic, what is your story? What were the, I'm sorry, I lost my place here.
Yeah.
Oh. Okay, sorry. So Carl, can you share what was the pivotal moment or story that shaped your path in HIV advocacy?
Yeah, absolutely. And one, again, thank you again for sharing your story and how you got here. It really resonates with me. You may recall I'm also a Louisianan by birth and upbringing. So you really didn't hear about HIV treatment, care, prevention, and most certainly advocacy where I grew up, at least. And it's no surprise that, our populations, especially Black gay men in the South, are disproportionately impacted by the virus, because there's not a lot of information that's available to them, especially at that time. I have always counted myself as an advocate and a policy person. I'm based in Washington, D.C., and I came up here to D.C. to work for my member of Congress from South Louisiana at the time. And I've tried to center, as my bio stated, my work around uplifting marginalized populations that I care about. And, at that time, it was people from Louisiana. I ended up working at Planned Parenthood Federation of America at the national office as a lobbyist and policy analyst, working on sexuality education. And through that work, I learned about PrEP. And this is back in 2011. I heard about this thing called pre-exposure prophylaxis, and I'm just thinking, I'm a Black gay man from the South. Like, I know how this, epidemic is impacting us, and I've never heard of this. How's it possible? And so I started to engage Planned Parenthood in PrEP, and advocacy around PrEP, and education around PrEP, and eventually in being a provider and referrer for PrEP. For folks, but that only piqued my curiosity, and the more I engaged with this amazing, HIV community, the more I wanted to be a part of it. And so I came to AIDS United to continue that fight. It's been amazing to really, tell the story, to see people tell their own stories about living with HIV, about thriving with HIV, but also to see more people avoid HIV through the uptake of PrEP. But I think the thing that has been really clear is the message is still not as pervasive as it needs to be. Like, why, are we seeing so many young Black men turning up HIV positive? And in large part, it's still a lack of education and a lack of access to really basic healthcare. And that's what centered me in this work.
Wow. Yeah, it's just so interesting that we both come from the same state, and we ended up in the Northeast. I lived in Washington, D.C. at one point, as in the starting out of the formative years as the Zero Project. And so it's interesting that we're, having this discussion and seeing this sort of how our journeys parallel.
Yeah.
We're kind of they're parallel, but our focus is kind of different based on our experiences or our lived experiences. So talking about the landscape, how have you seen the landscape of HIV advocacy, messaging, and community mobilization change over the last 5 to 10 years?
So I've been directly in this work for about a decade, and there's been a lot of change. Over the past 5 to 10 years, I think I've seen a change in the approach to advocacy and messaging, community mobilization that have really been driven by societal, technological, and policy developments. I think a key change has been the focus on ending the epidemic through initiatives like the EHE initiative that was really rooted in a community response to what was needed to end the epidemic, right? So AIDS United and the Act Now End AIDS Coalition worked across communities around this country to gain an understanding of what was needed in each of those communities from a plethora of perspectives to end the epidemic. And we saw that turn into the Ending the Epidemic initiative. And I think that has helped steward the prioritization of national and local strategies to end HIV. And that's just been transformative. I think we've also seen a greater emphasis on health equity and intersectionality. There's now a more explicit recognition of how systemic inequities like racism and homophobia and transphobia and even economic disparities drive the HIV epidemic. And through that recognition, I think it's helped evolve the messaging to highlight the unique needs of marginalized populations, including Black folks and Latinx folks and more. So that's amazing. And then I think another key topic is the rise of U equals U and again, pre-exposure prophylaxis. Just the campaigns around undetectable equals untransmittable have reduced stigma, have really highlighted the stories and experiences of people with undetectable viral loads. And I think that has aided in our ability to bring new folks on, new supporters on, to know that people who are undetectable and are in control of their virus are able to lead very normal lives and keep their larger community viral load safer and stop the spread of HIV. And then I think our tactics, digital advocacy and social media have just really kind of bled through everything that we do, particularly in light of COVID-19, right? We all switched to this virtual stance. We're doing this, 10 years ago, we would have never had this conversation over the computer. But we can do this from wherever we are, and we can make sure that we are advocating with the folks that we need to advocate from anywhere in time and space. And I think that's been really transformative. And it's also helped us hold policymakers accountable because they have to make space to hear from us, and they're limited excuses. And then I think finally, I think more recent development is increased advocacy around privacy concerns tied to molecular HIV surveillance. This issue has sparked really critical conversations about ethics and consent and data ownership. I think that's something that's been a part of your work. Yes. And demonstrating the power of community mobilization to challenge policies that harm people living with HIV. So, I mean, I think in short, the past decade, we transitioned toward ending the epidemic with more inclusive and equity-focused advocacy and a greater reliance on scientific breakthroughs and digital platforms to amplify our messages.
All right. I'm sorry. I have to say this just so I'm clear, because I feel like people think that when we do talk about HIV issue or advocacy or the landscape, even that it's just about people living with HIV, which it is, but it also is about people who are not living with HIV. So when we talk about ending the epidemic, I just have to say, it's not ending for me as a person who's been living with HIV for 21 years now. And so our fight is a little different in terms of just trying to hold on to what we have in terms of access and equity in healthcare and that sort of deal. And so I say that to say so that people who are not living with HIV know that there's a space for them a place for them to get involved in advocacy as well on the topics that you just covered, especially as it relates to PrEP. And so I just have to like do a little disclaimer there to let them know, like, this conversation is about HIV and people live with HIV, but it's also about those who are not living with HIV.
Yeah, that's a really important flag, and I think it's also important to flag that you're right. There is no cure at the moment, right? And this will impact people for decades to come, whether or not there is a cure. But it's our hope that we can keep those who are negative, HIV negative, and for those who are positive, until there's a cure, we can keep them virally suppressed and living their best lives. But it's important that we make space for everyone that wants to be involved in this movement. So I appreciate that.
Absolutely.
So I've got a question for you. How do you view the current state of HIV advocacy, and what strategies would you recommend for navigating tomorrow's political environment?
Okay, so this question, oh my gosh, it's like a fresh new question of all questions I've asked, and I've thought about this. And so I feel like HIV advocacy today is a mix of things. It's a mix of progress. I mean, it's 40 some years, all of my life, basically, highs and lows of things that we've seen change and that have advanced. So it's a mix of progress, a resilience in terms of our community engagement, mobilization, or community empowerment, if you will. And then there's the resilience. Ongoing challenges that exist as well. But there is renewed focus on equity. We've learned that the gap in the HIV response currently globally is due to human rights. And so there's this focus on equity, human rights, and then, of course, ending stigma, that word always comes up, to build. And so with equity, human rights, and ending stigma, we want to build a healthier and more inclusive world with, as I like to say, with compassion and with understanding. And so some of those key elements that I'll lift here. So when I talk about stigma, so despite the medical advancements, stigma remains a major barrier due to misinformation. I mean, people are still holding on to with the mindset of the 80s and 90s. And we've now moved into a whole new century and with a lot of advances in the technologies and in the science as it relates to HIV. And so we really shouldn't be in that mindset anymore. If anything, we should be respecting the history, and the fight that people have, so that people today can live in a way that they don't have to live in fear or without access to treatment and care. Also, advocates are pushing to repeal or modernize outdated HIV-specific criminal laws that do not align with current science and public health, and that is my work today, and I think it will continue as I move into my second decade of advocacy. This issue is not going anywhere because we're not simply addressing it. The community that are led and for and accountable to communities impacted by HIV criminalization. But in terms of those entities, those institutions, those elected officials, public health officials, they're not saying enough in regards to condemning HIV criminalization in the U.S. And another topic that I'll raise is many people are living with HIV are aging, including myself. I'm a long-term survivor of HIV and HIV criminalization. So it requires, new advocacy priorities around healthcare access, social support, and mental health. And so, but overall, people living with HIV, we're demanding better, better quality of life as it relates to the fact that we're still living, we're still going to be here. And that's because we're still dealing with structural racism, healthcare disparities, and political challenges that continue to affect our communities. And so a couple of strategies that I thought about, and I'll be quick here with those. One, I want to say we want to make sure our strategies for navigating tomorrow's political environment that are grounded in lived experience and data. And I feel like some of those strategies could be, one is shared advocacy responsibility, as I sort of touched on. The fight to end the epidemic, promoting PrEP access and dismantling HIV criminalization must not solely rest on the community of people living with HIV. Another strategy is continuing to have meaningful involvement of people living with HIV. I feel like there's, in some way, that has improved, but there's still more to be done with that. Prioritizing our voices and our experiences to ensure that the leadership, whatever that is guided by the systemic solutions without overburdening us. I mean, we're already dealing with enough. The other is the cross-movement collaboration, partnering with racial justice, LGBTQ, and reproductive justice movements are central to addressing these barriers and stigma and inequality. And also resourcing the movement. We still need to continue to be funded, especially in the climate in which we're moving in for 2025 and on. We're kind of at a position where, a point where funding is questionable. We don't know what it's going to look like. And so, and with that, we'll be able to invest in leadership development, training, and financial support for advocates who are living with HIV, to ensure that they have the tools and resources to lead without being overextended. And so, and I have one more, stronger political will and education. We have to continue to educate everybody. I mean, a decade has gone by, so that means that's new people who aren't aware of where we are with HIV. They need to be educated and informed, including legislators, including other elected officials, public health, even people that work in our communities. We all need to be educated on what the latest developments are, because many are coming in with the passion for the work, but they don't know the history. They don't know where we've been and how we are and how we got to where we are. And yet communities are still continuing to be impacted in ways that everyone who's working in this field don't understand, because they've not taken the time or had the time to learn about our history.
Thank you for that, Robert.
Yeah. Okay. So, Carl, what are the biggest challenges and opportunities in advancing the fight to end the HIV epidemic from your perspective?
I actually really feel like you hit the nail on the head with your last response. I think our biggest challenges are, it's like the challenges that I think probably folks can relate to in their own lives, their own homes, right? It's money, it's it's resources, it is like will. So it's both like the political will and community will, and education and understanding. When I look at what we've been facing the past several years and what I expect to see ahead, I agree with what you've said. We have so much education to do. We as a community need to be educated on what's effective. I've been directly in this fight for a decade, indirectly for longer. And what you see in, I think, our progressive movement is a little bit of stagnation. I think we really need, as a community, to be in lockstep on messaging. We need to understand what is persuasive to policymakers. We need to understand what is persuasive to the general public who are not engaged in this work, who are not necessarily living with HIV and don't follow as closely, to know what to say to make them care. People really do, I think, the broader public, and this is a really tight-knit community, but I think we can be an echo chamber. The broader public doesn't realize, I think, to the extent that HIV is still, a serious issue, that there are so many new infections, and what's supposed to be, the greatest country on the planet, we don't have equitable and reasonable access to healthcare, and we've got to see what's compelling to make folks support policies that broaden our access to healthcare for everyone. In terms of political will and education, we have to educate policymakers on the same things. We have to educate policymakers on the risk within their communities, on the markers that connote a potential outbreak, so that they can see when action needs to be taken. If something's on the rise, we've seen cases throughout the years of higher incidents because of a lack of investment. So we need to tell the story. I'm still hopeful about the folks who represent us in DC. These are some of the most contentious times, but I'm still hopeful that these people come to DC in order to make their communities better, regardless of their political party. And it's our jobs to make sure that they have the data, the information, the stories to know why it matters to their community. And we don't have to make it personal, right? It's just, this is your community. You're here to represent us. You might not care about us. You might not care that I'm a Black gay man. You might not care that she's a trans woman, right? But you do care that this can impact your broader community. And then money. We have to make sure that policymakers know that investing in HIV prevention, treatment, and care is a money saver. That the lifetime costs are to treat someone living with HIV is exorbitant, and it's worthwhile to treat them. But there's also a lot of savings to be found from prevention and keeping folks virally suppressed. And then kind of to add on to that, you're right. I think resources for our work have been dwindling as well. And we need to make the same case that I just outlined to funders and non-traditional funders. I'm so thankful for the funding that many of our organizations have received from leaders in this sector, but we've also seen many funders exit this work in the past decade, and we also need to appeal to broader LGBTQ funders, right? Because this does disproportionately impact LGBTQ folks, and we need to make the case that if you're investing in LGBT communities, if you're investing in global work, there's still space to invest here back home.
Yeah, absolutely. And it's something you said that reminded me as I watched the news and trying to understand where we are in the country, where people are in the country. And something was mentioned about working class people, that they are perhaps tired of like the cultural issues or as I read it, the social issues. And so that may affect how they vote on certain things, right? Or how they pay attention to certain things. And I felt some kind of way by hearing that, because I'm like, well, I work, I consider what I do to be work. I may be even classified as working poor, but I'm working as well as a lot of people. And so, but it made me think about like, well, if the working people are tired, imagine how we feel about the fact of how we're having to fight for everything, particularly those of us with multiple marginalized identities and can come from various communities. And so I think that's something that we need to be mindful of, is that if the working people aren't paying attention, and if they are paying attention, it's only when, something's happening to them personally or someone they know, or if it's something reporting about us, right? I even go so far as to say sometimes when we're talking about HIV, AIDS, they show pictures of just different communities or people in Africa. And especially when it comes to a drug or something like that. And I was like, well, why are they showing that those like communities of people living with HIV when actually this drug is about people who are not living with HIV or something to that effect? And so it's messaging, and the way that we sort of present information is so important, because if the working people are busy working, that means they're not really fully paying attention. And so that is a problem for all of us.
Yeah, you have to remember we talk about communications, communicating and messaging. Communicating has to be two-way, and if you're saying something and it's not being picked up by the person you're talking to, then it's not effective. And, I think AIDS United as an organization, we're a nonpartisan 501c3 organization, and I think we know that there are people living with and at risk for HIV in every political party on the planet, right? It's not a political thing, but I think folks have been able to effectively message against LGBTQ folks because they've been able to other them. And I think we have to show people that it's not, it's not just some people over there, like you said. It's not just some people in Africa that we're sending money to. It's also your cousin. It's just
your cousins,
right? Yeah.
So, AIDS United has been a powerful force in developing HIV champions through initiatives such as AIDS Watch and the Public Policy Council. What steps do you think policymakers, organizations, and leaders need to take to empower new champions in HIV advocacy?
Yeah. I guess I'm a broken record. Education and getting people out there telling their stories and sharing their message with policymakers. AIDS Watch is an excellent place to do that. It's not the only place, but it's an excellent place. I love AIDS Watch because it is, being here in DC and working with federal policymakers, it is the closest I get to direct service, right? Talking to folks who are actually doing the work on the ground and just living their lives and thriving with HIV, hearing, their stories about how they get what they need to lead, healthy and fulfilling lives in spite of so many challenges is so amazing, and it's like rejuvenating to me, and we need more of that. We need more of them on Capitol Hill, in their state legislatures, in their planning councils, at the local level, talking about what they need and what's working and what is not working. So I think it's our responsibility to support creating spaces for folks to tell their stories. And as you mentioned earlier, creating resources to help them stay educated and stay on top of the epidemiology and the politics, and giving them space to lead, to step up and speak up.
Absolutely.
If I can ask you a question, from your perspective, how can we ensure leadership opportunities are accessible to the most affected by HIV? And how do we cultivate a more inclusive and impactful movement?
I'm going to say prioritize accessibility and investment. Being intentional about it. In order for it to happen, it has to be prioritized and it has to be investment. So, and what I mean by that is just allocating funding and resources to support the leadership development, training, and mentorship. Finding that a lot of people are interested in doing HIV advocacy sometimes, besides knowing where to start, a lot of them may not, if they're an organization, or if it's an organization, or if it's the LGBTQ community, they are not sure either how to do it, or they don't have the resources. So it's important to invest and to allocate the funding. Secondly, value and compensate lived experience. That's why my tagline is leveraging the power of lived experience as a catalyst to change. That's something that I realized that I have is lived experience. I can't express that enough. A lot of people look at degrees and whatever other measures that they use, but people are here living, they're living it. So we need to recognize the expertise of people living with HIV, compensate them fairly for their time, knowledge, and their leadership contributions. I can't stress that enough. Lived experience is credible. It's definitely credible. Last, I would say foster intersectional community-led advocacy. The community is where I come from back home in Louisiana. And it's the same. I feel like I'm still in the community even now as I do my advocacy sort of nationally. I'm part of the community, and I see the potential and the abilities that we have to be in leadership, to be in decision-making, and to be representative of various communities. For example, there's the Health Not Prisons advocates, Health Not Prisons Collective. They have a Health Not Prisons advocates program. There's a Zero Project. They have the Zero Project Justice Institute. And then PWN even has a policy fellowship. And so the community has created all sorts of opportunities and resources based on the funding that they have received to sort of build and develop new leaders. And the leaders, they're out there, there's many of them from all of the various organizations within our communities. And they're ready to lead, they're speaking. And so we have to provide the pathway for that to be able to happen. And then also, as we do that, we need to also continue to address stigma and discrimination within organizations and systems to ensure that these leaders, these new leaders and emerging leaders, feel valued and safe to contribute.
That's great. Thank you. Speaking of pathways, where do you see the future of HIV advocacy and racial justice intersecting, Robert?
Oh, I feel like it's already here. It's been here for a while. In fact, I've been a part of a few initiatives as it relates to HIV racial justice. HIV racial justice now is an entity that of 20 or more leaders of color that gathered back in 2017, I want to say. And together we developed a declaration of liberation, a declaration to express how we felt about the importance of HIV racial justice, or racial justice being part of the HIV response. Considering that that looking at the numbers, the figures, we don't dare have to repeat them because we've been saying them for decades now in terms of how HIV, who it impacts and where is impacting the people. So I'm already seeing it, especially through the Help Not Prison Collective. They do an intersectional initiative. And part of our framework is within the racial justice framework. So it's already happening, and it's a framework that I live by. It's a framework that we're also introducing to funders within the philanthropy sector who have already committed. For example, funders concerned about AIDS has already committed. In fact, they partnered with HIV Racial Justice Now to develop some guiding principles to help funders understand the importance and how to get themselves in alignment in terms of their work in their organization as it relates to doing HIV advocacy or funding HIV advocacy. And also I've been involved in HIV advocacy trainings within the LGBTQ or equality spaces, helping them understand the principles and frameworks in which we operate within the HIV advocacy world, so that if they are an LGBTQ organization, they focus on that advocacy and they're interested in HIV advocacy, then here are the guiding principles, or here are frameworks in which you should adopt to be able to do that advocacy work and do it effectively and do it in partnership and collaboration with the HIV community. And so, so that creates opportunities for us to continue to work together as we address LGBTQ rights as well as HIV advocacy rights and issues.
Thank you, Robert.
And with that, what gives you hope for the next generation of HIV champions, leaders, and advocates?
What gives me hope? We all have our work cut out for us, but especially thinking about future generations, the young folks in the work, there's so many brilliant young men and women in this work. I see that firsthand at AIDS United among our staff. Our staff is rich with lived experience, and that ranges from, just direct HIV to harm reduction, sex work. They really bring their personal lives and experiences and passion to this work. And it's really impressive. We also have AIDS United hosts what's called the Pedro Zamora Fellowship, and we host graduate students or college students that are interested in this work. And we've had an amazing cadre of Zamora fellows who I see all over the country. For at least my decade in this work, we've had a dozen or so, and I see them all over the country in amazing organizations doing great work, now on boards of organizations and really shaping this movement for the future. So that's been really amazing to see. I think I think also, we just as a community just mourned the loss of Cornelius Baker, a longtime advocate, and I think his lesson to us all is about investing in the next generation, and seeing the young men particularly that he impacted at his service last Friday show up in DC from all over the country and the world shows the passion and dedication that is this movement. It's not just a job for folks, it is their lives. And I think this is a movement, a disease state that is unlike any other. I think I said this a little bit earlier, that it's, this is a family, and people were really invested in this, and that gives me great hope.
Yeah, I couldn't agree with you more. I've had students, many people don't know this, but I also have my master's in student affairs and higher ed. And with that, I'm able to leverage my experience in advocacy to mentor students or advise them on the issues that I work on, particularly around HIV criminalization. And so they have come from all backgrounds. And some of them are not even, some are living with HIV, some are not. And so that warms my heart and gives me hope that there are people who are not sort of involved in our networks, but they're seeing what we're doing, and they're curious and they're interested, and they're reaching out to get involved and to better inform themselves about these issues, because some of them want to be the next leaders, next policy leaders, and so on and so forth. And so I'm glad to see that, because we're living in such a time where misinformation is king, and I'm just glad to see that there are the young people who are our future right now, that are interested in knowing what the history is and where they fit in with that today. And so I'm glad to see that you're also seeing that and experiencing that feeling, because it's the feeling that I'm getting also as I engage with new people. So
and I brought up Cornelius because I'm also proud to see our movement leaders who've been in this fight for 40 years make wanting to see that next generation step up. And wanting to see them succeed, and sharing their wisdom so that we can carry this fight forward.
Yeah.
I think that's all of our questions, Robert. This has been a really rich discussion, and I really appreciate it. And thank you from the bottom of my heart for your work that you do on behalf of all of us and on behalf of the HIV/AIDS community. It's amazing to watch your career and to see you in all of these different spaces speaking truth to power. So thank you so much.
Yeah, and thank you for the opportunity to be here to speak with you, because you and I, we don't get to talk that much. But at times we do see each other and speak, and I'm always grateful for that. And thank you for what you're doing and just where you're sitting and what you're doing. It doesn't go unnoticed, and so I'm just glad to, especially as a Black man, in this work, it always makes my heart glad to see representation, and so thank you, and I'm glad to be to acknowledged for what I do. I do it not for any form or fashion. I do it for my survival. You said that, and it is true. It is about my survival, and I see it for being that way from moving forward, because we're just not there yet, and so I have to keep on fighting for my survival.
Absolutely, thank you so much. Just to acknowledge our sponsor, We Are United is an initiative of AIDS United in partnership with the CDC to stop HIV in all communities. Learn more about this initiative by visiting our website and order your free HIV self-testing kit using the link below. Robert, do you want to share any final thoughts or reflections?
I would just say, I hope people will look at this and really, think inward and see how they can contribute or join or be a part of this work. And if you're curious about what I do and who I'm in and what entities I'm involved with, you can learn more about me at my website, robertsuttle.com. My site is up and is due to have some updates soon, but you can find out as much as you need to at this point. And also, if you're interested in the things that I'm working on, the Elizabeth Taylor AIDS Foundation, Health Not Prisons Collective, or the Seropart, please reach out to me, or the HIV Justice Network. Please reach out to me. I'm happy to talk with you and work with you. And also, shameless plug, I want people to get the book, Criminalized Lives, HIV and Legal Violence by Alex McClelland. And so it's a good book that talks about the experiences of people who have experienced criminalization in Canada. And I wrote the foreword to give more perspective about HIV criminalization's impact here in the US.
Thanks, Robert. I will order my book today. And to everyone in the upcoming administration, advocacy will be the best solution to ensuring we are on the pathway to ending the epidemic. Please join us at AIDS Watch, March 31st through April 2nd here in Washington, D.C. And you can find information to register at the link. It's one of the best opportunities to engage at the federal level, and we look forward to seeing you here in D.C.
Do you know your HIV status? When you do, you can take control of your sexual health. HIV self-tests give you the power to decide when and where to test. You just swab and stick it in the tube. Test in the privacy of your own space. You can set a timer, sit back, and wait. In as little as 20 minutes, you'll know your results. No matter your test results, you have a community waiting to support you.
I love being able to test where I want.
I love that it's confidential and quick.
You gotta love free.
It makes me feel empowered.
When I show myself love, I show my community love.
It's important to know my status.
It's important to know your status.
It's cool to know, you know?
If we all get tested, we can stop HIV together. Learn more about HIV testing, including free HIV self-tests, at cdc.gov/HIV self-test.